Gambia, often called the smiling coast of Africa, is known for its warmth and hospitality. But behind that smile lies a growing crisis. Across streets, markets, and public beaches, more Gambians are silently battling mental health challenges. From substance abuse to depression and stress, mental illness is becoming one of the country's most pressing but least addressed public health concerns. In Abuko, within the Kanafi municipality, about 18 kilometers from the capital, Banjul stands Help the Mental Disabled Association, a private funded group that advocates for mental health awareness in the Gambia. Here, we meet Maimuna Faal, the founder and chief executive officer of HEMDA, who gives insight into the association's work.
HEMDA means Help the Mentally Disabled Association. It was established in 2020 when we believe that we need to do a lot of things to support our families battling with mental illness, especially those that are stranded on the street. Not what we see on our social media platform is all that what we do. HEMDA does a lot of things. We do community sensitization, we do home care service, we also support homeless mental ill patients. If we go to your house and we've seen the environment that you are living in, HEMDA will bump in to build a house for you, make sure you live in a very, very comfortable life, yeah, like any other person. We just have concerns when it comes to people who are being abandoned, who are mentally challenged and are being discriminated by the society. And I believe as human beings, we need to do something. Yeah, that is the most inspiring thing that makes us initiate this organization.
To keep an organization like HEMDA running, offering social support to the people with mental health conditions who have been left stranded requires funds. HEMDA's financial backing comes largely from monthly contribution by its own staff and donation from Gambians living abroad. According to Faal, no direct financial support has yet come from government, which places heavy financial burdens on the association.
Well, it's definitely challenging on that side because we are definitely struggling when it comes to finances. But basically, we do some contributions monthly, and through the help of our wonderful donors too, both diaspora and in the Gambia, some also do help and support us with the little they have so that we can be able to do our work. We have not yet received any support from the government or any NGO or any institution. So, for the government, we really want them to do that, because as you can see, whenever we go on our community sensitization or even on TV or even on radio, we do emphasize that the government needs to do that because it's their right, it's their duty to do that. We as HEMDA, we are just complementing the efforts of the government, but we cannot do everything. But we believe through their support, we can have a Gambia, street-free of mental ill people.
Addressing mental health in the Gambia is a major concern. Illicit drug use, societal stigma and discrimination, and high unemployment are among the key drivers increasing mental health issues nationwide. These challenges, as stressed by Faal, significantly complicate efforts by organizations like HEMDA to provide adequate care.
It's very, very, very important because basically I think that is the fundamental aspect of it. We must always, we as HEMDA, we always go to the community, do some community sensitization on youths that are using these illicit drugs, and also we do sensitize families on ways and their roles and responsibilities on how to take care of these people whenever they have them in their community. It is definitely affecting us because most of the time when we reach out to them, try to counsel them to abstain from these drugs, normally what they do tell us, well, we want to travel, we want job, we don't have anything to do, and it is difficult for them to abstain from those drugs. Some of them use it as a strategy for business, because I do ask somebody one time and he said he has no job, so the only way that he can get money is through selling drugs.
National Assembly, where laws and bills are debated, Honorable Modou Lamin Biram, Member of Parliament for Banjul North, has emerged as prominent mental health advocate. He often reiterates that there is no health without mental health, emphasizing the role of policymakers must play in confronting this growing crisis.
As also in Parliament, I'm a mental health champion, and like you said, I am somebody who really advocate about mental health, especially understanding that there is no health without mental health, and also understanding that mental health is the cornerstone of any developing country. This is something that I really have passion for, and I really want to see a solution to it. And one way that I am doing it as a member of Parliament is to advocate, especially seeing to it that the outdated Mental Health Act, which is called the Lunatic and Detention Act since 1917, which is already 108 years old already, is something that we need to change as a country and see how best we can update it and have an updated Mental Health Act. Currently, I am working with the Ministry of Health and also some organizations in the Gambia, like HEMDA, Peaceful Mind, and also other organizations, to see to it that the issue of mental health is well addressed in this country. As part of my advocacy, like I said, as part of the Apex Authority, which is the Parliament, I always bring forward issues surrounding mental health, especially the legal framework, which requires an updated version, so that we'll be able to tackle so many things, especially from government, understanding that government are the people that are at least managing the junk of the state resource, because the government can do a lot of things, especially when it comes to the state resource. So even when it comes to the issue of the budget that is allocated to Tanka, which is our only psychiatrist center in the Gambia, through the Edward Francis Small Teaching Hospital, I always advocate for the required allocation in terms of budget allocation appropriated by Parliament, which is indeed very important, because that center is a treatment center and it requires so many things. And as you go there today, the capacity is only 150 patients that they can accommodate at once. But unfortunately, we are also faced with, as a country, people that are suffering from mental disorder that are on the streets, which is very unfortunate.
Mental illness does not only affect older people. The majority of sufferers are young, as many mental health experts point out. Youth are especially vulnerable due to pressures such as substance abuse, unemployment, and lack of opportunities. Lack of prioritization of mental health is alarming. From government bodies to local communities, many mental health patients are reportedly ignored or abandoned, especially those in rural areas. Despite HEMDA's effort, community-level support is uneven. Patients who are discharged are often poorly integrated into family and community life, facing stigma and discrimination that hinder recovery. From declining mental well-being to rising depression, without swift and coordinated response, mental health issues are increasing. Njie, Deputy of HEMDA, urges all members of society to treat those with mental health challenges with dignity and fairness.
Charity begins at home. That's the main problem we are facing. All of these patients we are facing in the streets, they have a family. Where are they? They should be the first, they should be the foundation before we'll come. We are a second partner. But the first partner is the parents or guardians. But for what we feel, if a family member is mentally challenged, first what we think of, we just throw them away or we isolate them. that will increase the mental health illness in them. So what I will urge, and I will tell them all, let them all come out. Any mental patient they have in their compound, let them brief him, and so that they can engage him in the family. Because I will give you one example. If you have your patient in the hospital, especially admitted in the hospital, you will buy this food stuff and everything, go and visit him. But why not our mental patients? Mental health is a innate, or like any kind of illness. It's just like a malaria, and they are all treatable. So if we help them in the home level, they will not come to the street.
Addressing mental health effectively requires more than advocacy and education. A mental health bill is needed to serve as a legal tool to protect the rights and freedoms of people living with mental illness. According to HEMDA's Secretary General, Mbaye, the bill has long been awaited.
We need that bill to be passed, and it is long overdue now. The wait has been so long, and then I think all the mental health stakeholders should come and form one umbrella in order to challenge these things. The Parliament should pass this bill as soon as possible, because the wait is getting out of hand. It is very, very sad, as Gambia is one of the only countries that doesn't have a rehabilitation center throughout the whole world. It is very, very sad. What champions is the government. The government should come and champion this bill. The Parliament should come and champion this bill. The government should make sure the rehabilitation centers are built in this country, because most of these people don't need treatment. What they need is rehabilitation. Most of these people, they don't need treatment, they need rehabilitation. And there is no rehabilitation facility in this country. Of recent, we are informed that drug law enforcement agents, there's a project underway at the drug law enforcement agent. But that is long overdue. Since 1965, since we attained independence, we have no rehabilitation center in this country. And it's a very, very big insult to our nation. And it's a very, very insult and outcast to those who are mentally unstable.
The current law in the Gambia is the Lunatic Detention Act, enacted in 1917 with amendments in 1918, 1946 and 1964. Efforts to pass a new mental health bill are reportedly underway. Parliamentarians, including Honorable Modou, Lamin, Biram, have expressed that in joint cooperation with the Ministry of Health, a modern bill is expected.
It's very unfortunate, and this is something that, to be honest, of recent, the Ministry of Health for the first time validated the first ever mental health policy. And part of that mental health policy includes issues surrounding people that are mentally disabled and homeless. And as I am talking to you right now, I am also working with some friends, family friends and partners to see how best we can come up with a program, because we already started engaging the stakeholders. We engage the mental health unit of the Ministry of Health. We also engage the CMD of the Edward Francis Teaching Hospital. We also planning to engage the Ministry of Interior, because we believe all the stakeholders need to come together and collaborate and see how best we can put up a good strategy that will help in terms of eradicating people, that is zero tolerance of people that are mentally ill that are on the streets, because that is the motive of what we really want to do. And like I said in the beginning, as the president of the Global Youth Mental Health Forum, it is always very important to set the example from in my country before I'll be able to go to any other country within Africa or even beyond to talk about issues surrounding mental health. So in that regards, I always seize the opportunity to urge not only the parliamentarians but each and every Gambian to understand that there is no health without mental health, so that we can see how best we can address mental health issues in this country. Yeah. Currently, with the engagement that we had with the ministry, we are expecting the laying of the first reading the ending of next year, because currently I believe through WHO or one of the supporting partners is working with the Ministry of Health to review the existing draft. So that is why currently nothing is being done yet, but at the Ministry of Health, they are currently engaging with the donor partner to talk with experts that are even outside and inside the country to see how best they can work on the draft. And that draft will be taken to the executive for approval and then further introduced to Parliament, which I believe when it is introduced to Parliament, with the current advocacy in terms of addressing mental health in this country, the process will be expedited, even though it will go through the normal process, but it will be expedited so that we'll be able to have an updated mental health act in this country. Yeah.
Drug abuse is leading factor in admission to Tanka. Health experts report that many patients, especially males aged 18 to 35, have histories of substance misuse, including cannabis, ecstasy, glue, inheritance, and alcohol. Some mental health disorders are triggered or exacerbated by drug use. Being the only psychiatric hospital in the country comes with many challenges: insufficient patient housing, limited medication stocks, limited mobility for outreach, and shortage of staff. In emergencies for patients in remote regions, access is especially difficult.
A good example is right now we are overcrowded, and we have some doctors, like one of the doctors right now is here with me, which is Dr. Touray, and we also have some Cubans that you saw some time ago who came, and mostly they come on, the Cubans come on on Tuesdays and Wednesdays to make review and discharges. So right now we are overcrowded, and we are expecting Dr. Touray and his team to do some discharges, and the Cubans as well, because we didn't have enough human resources. We have human resources, but we don't have enough. If you look at the patient-staff ratio, if one will calculate, it's going to be very low in relation to service provision. But we are still managing, because that's what we can do best. We improvise some services because we need to do them. There are a lot of challenges that we have. He's one of the challenges we used to have, but his coming have at least do a little bit of burden relief for us, because we didn't have a psychiatric doctor who is like a resident like him, who is going to be coming to the hospital on a regular basis, see the patient. Some of our staffs even will have some conditions which he takes care of, because he's not only a psychiatrist. He have gone through all his medical services. He was a house officer until he get all his duns done, until at this level now he is qualified to attend to both physical and mental health conditions. So he's coming here have at least relief of a burden. The other burdens we have is transportation. This hospital right now don't have its own mobility that takes care of our transactions. If we have emergency needs, we will call the main hospital to help us with an ambulance to reach to that emergency. So obviously I will say that there are other emergencies that when we have, probably we might not be able to get the support we want, because if an example is going to be a CVA, that's cardiovascular arrest. If somebody here have asthma attacks and other things, what are you going to do with the person if it is severe? We don't have ambu-bags, we don't have other support systems that can help us get rid of those services quickly. So when we call the ambulance service, before the ambulance service could reach here to make sure that the patient have that help, God knows what might happen. So that's also another burden. And some medications where the supply also are delayed, and sometimes it takes us time to have a continuous medication track line, because antipsychotics are very expensive, to be honest with you. But sometimes now it is much better than before, but it's not very easy that we cannot rule it out. That is also a challenge, because the government is doing a lot, but sometimes it is a challenge that we have. Another challenge is human resource. Not everybody want to be like me and him. Sometimes you challenge some nurses and some doctors to come to Tanka to work. They see it differently. Sometimes in my street, some people, when you attempt to help them, they said, can you do anything apart from helping people with mental illness? So even him, he's been judged. He's saying that, you are a doctor, what are you doing with Tanka? And it's very surprising that they don't know that Tanka probably even need that service more than he gives to other people. Yeah, so all those are burdens that we are going through.
Advocates emphasize that decentralization of mental health and rehabilitation services so that clinics, regional centers, local health posts can provide support essential to reduce stigma and make care more accessible outside the capital.
Decentralizing mental health is a very important or a keynote that everybody should look into as a health personnel. But we are thinking about not, anyway, that is not our say, but we will, if the government will seek our advice or our technicality in building a new hospital, for me personally, I will say we will prefer the system to be decentralized in all health regions, because West Coast have a regional health office. The LRR has, all the regions of the Gambia, they have regional health posts. Those people should be open enough to establish a mental health institution in all regional hospitals across the country, whereby somebody who is a trained personnel, this had happened before. Mr. Sonko, the then program manager for mental health, did some mental health psychiatric training nurses who have been put to all these major health centers, and they functions there. This helps to limit the amount of patients coming to Tanka and putting more burden on institutionalized system. And I think people in the world now, the West and other parts of the world, they are going out of institutionalizing people with mental health. Because if you will put a mental health institution in Serekunda General Hospital, like it is already there, Brikama General Hospital, it is not there, Sukuta is not there, Brufut is not there, Gunjur is not there. But if you put those institutions, or even a small office at those institutions, patients going in there or service users going in there will feel more comfortable to go and seek a treatment than coming to Tanka, because some of them will say that, what are you doing in Tanka? Like 3-4 days ago, I was in a class at the University of the Gambia, and somebody was saying that one time he was going to social welfare and a colleague met him on the street and tell him that, I hope you don't get somebody pregnant that is bringing you here. So you can see the stigma and how people direct other observations on people, because of that's what they think about them. Just people come to open judgments on other people's condition. So we believe decentralizing it in that notion would be better than building other hospitals for the psychiatric institution.
In a societal burdened by social vices and inequality, the vulnerable, those with mental health conditions, are especially likely to be marginalized. Dr. Bakary, Touray, resident psychiatric at Tanka, and others call for equal treatment of those affected regardless of their social and economic status.
So if you are physically and mentally fit today, and you see someone who is mentally challenged, don't think that you are safe. Be compassionate, and then reach out and help anyhow you can. If you're not going to help, the least you can do is not to discriminate against them. And then people should support mental health, mentally challenged people, and people should also encourage people to express their emotions and stop labeling them, because that is what makes a lot of people not come out to say what they are going through. Because if you say, I'm not feeling well, I'm sad, they will try to put labels on you, and then that will make you feel discriminated against or whatever. So that's the general advice that I would give to everybody. Let's just treat mental illness as we are treating diabetes and hypertension.
Among organizations working with mental health space, HEMDA is frequently mentioned for its advocacy and support work, but reliance only on personal contribution and diaspora donation is not sufficient to meet the countrywide need.
HEMDA is an exception. We have some more, like the IVHMO, something like that, if I could remember, the mental health volunteers, Solomon Korea and his people. They come here, they have some media, they bring some media houses, they bring some entertainment with the patients. But HEMDA is an exception. HEMDA does something special. When I say special, and me, it's a little bit of what we do, because who feels it knows it. HEMDA will go to the street, look at these patients, work with them. They don't look at their aggression or their hygiene or things like that. They don't look at all of that. They put that aside. All the stigma, they put it aside, and then give 100% attention and love and care that we give to our patients here. They will give them a bath, give them a new haircut. Sometimes, one time I was working with them, we visited a patient. I'm not going to make mention of the patient's address and condition. That this patient was given by HEMDA a brand new house. They built a house for the patient, and this was beautiful. So HEMDA, you can sit here and give the whole day good about how much they help in with mental illness. Though they are not an institution, they cannot do admissions, but they are making a hand outreach to these patients by providing services that looks exactly like the service we provide for our patients in the hospital.
Official report gives some indication of the scale of the problem. A survey by the Mental Health Service Gambia in 2025 found that about 1 in 18 Gambians, approximately 324,000 people, are experiencing some form of mental health issues. Out of that figure, about 81,000 are dealing with severe mental health conditions. Another estimate by the National Human Rights Commission puts 27,000 individuals as having severe mental or substance abuse disorders, and additionally 91,000 with mental health challenges requiring treatment. Key contributing factors: economic hardship. Many Gambians face financial instability, poverty and unemployment. Poverty rates remain high in rural areas. Substance abuse, drugs, alcohol, inhalants such as glue and surgical spirit, cannabis and ecstasy are contributing to mental health disorders, particularly among young adults. Limited infrastructure and human resources. The country has one inpatient psychiatric facility, scattered outpatient services, and a single community mental health team. Staffing levels are low with high attrition. Stigma and lack of awareness. Many people first seek help from traditional healers. Societal stigma, misunderstanding of mental illness, and discrimination impede early diagnosis and treatment. The gap between those suffering with mental illness and those receiving effective treatment in the Gambia remains large. Legal reform, increased funding, more mental health professionals, decentralization of service, and community education are widely advocated as urgent steps forward.